I can't.
Well, then there's a reason for that, Paul.
I'm not allowed.
I'm not privy to that. I'm just assuming.
Okay, it's fine. Oh no, I've got it now.
Okay, I've been given the green light to start. So welcome everybody. Thank you very much for joining us tonight for a really special event. I think, you know, there are lots of questions that are coming up for people in the LGBT community when it comes to the COVID-19 vaccine, and the LGBT Foundation decided to host this event with some experts that can answer some of your questions. Now, my name is Rita Loy. I'm CEO of Gaysions and also contributing editor at Gay Times and a reporter for Vice. A great honor to be hosting this today. So I'm not an expert. I'm just going to be, not at this anyway, I'm just going to be fielding questions through. So I'm going to talk you through how you ask questions. There's some already been sent in that we'll be working through, but there is some functionality for you to ask questions live as well. Firstly, just to say that this is a safe space. What we've done is we've decided to host this as a webinar, and what that means is that you can ask questions anonymously. So if you ask the question, then you're in a safe environment to do that. You don't have to let people know it's you. Nobody needs to know that it's you. If you do feel unsafe at any point though, or you witness anything that you feel uncomfortable with, that you find problematic, you can let our moderator know, and that's Joe Nellist. And you can message Joe through the chat function there. Now, the chat function is going to be disabled between attendees, but there is a Q&A section which you can utilize to ask questions through. So on your screen, you should see a button that says Q&A, all of you. You can ask your questions through there. We'll see them over here. You can also choose to send anonymously through there. So use the Q&A button to ask questions directly to us, and we'll field through those. I just want to really get on and introduce our amazing panelists. So we have two brilliant leading LGBT doctors from the UK. Firstly, Dr. Michael Brady and also Dr. Luke Wookey. We're going to hear a little bit about them now. I'm going to hand over to them in a second. And we're also going to hear from Paul Martin, who is the Chief Executive of the LGBT Foundation. So firstly, over to you, Michael, if you want to tell us a little bit about yourself.
Thanks, Rita, and hi all. Thank you for inviting me. It's a real pleasure to come and talk about this really important issue. I think it's really key that we address anxieties and concerns around COVID vaccine, particularly for LGBT communities. So my perspective on it kind of comes in two directions. I have well, I have more. I have two main hats. I'm an HIV and sexual health clinician, and I'm also the national advisor for LGBT health at NHS England. So both of those hats impact on how I'm really keen to address concerns and anxieties around the vaccine. So as an HIV sexual health clinician, I look after people living with HIV, and I also run a sexual and reproductive health clinic for trans and non-binary people. And COVID vaccine, anxieties about it, concerns about it, questions about it have become a really key part of the normal clinical consultation, partly coming from patients and service users, but also coming from me, because I think for the last few months, I've actually made it part of the discussion, bringing it up proactively. How do you feel about it? Do you have any concerns about it? So I'm kind of well versed in a lot of the concerns and anxieties that people have. I've seen it on a day-to-day basis. I'm sure many of the things that I discuss in clinic will come up during the discussion today. And then obviously, on a kind of one-to-one level, not just with LGBT individuals, but also those from Black, Asian and minority ethnic groups who also have similar concerns and well-founded concerns and anxieties. And they're all real and they should all be respected and addressed. Obviously, working in HIV, we work with very, very diverse populations. So this has now become kind of a normal day-to-day part of the clinical consultation. So there's that aspect that I'm coming to it from. And then as in my role as National Advisor for LGBT Health, my brief is to address health inequalities for LGBT people across the board. So on a national level, that's working across a lot of areas. So I'm also really keen to understand better and to listen to and discuss the concerns from the community and feed that into work that I'm doing nationally. So I'm really looking forward to the discussion. I'm really glad that it's going to be driven by questions from the participants, because that's what's really important. So thanks for the invitation and looking forward to it.
Brilliant. Thank you, Michael. Very happy to have you here. And over to you, Dr. Luke Wookie.
Thanks, Rita. Again, very happy to be invited along this evening. My name's Luke Wookie, my pronouns are he and him, and I am the clinical lead for Indigo Gender Service. And for those of you that don't know, Indigo is a new trans health service across Greater Manchester. We're a pilot service and we launched in December 2020. So we are an adult service and we currently have a closed waiting list of patients that were on a current gender identity waiting list but not had their first appointment. Those patients were offered transfer over into Indigo. So we're working our way through that big list of almost 700 patients. And more recently, obviously, with COVID, we've been working mainly or entirely remotely since we started the service. So I'm very keen in terms of the vaccine rollout to mean that we can get back to some sort of normality, and that would be nice for me to see patients back face to face in clinic rather than having all remote consultations with my current trans and non-binary patients through Indigo. There have been some benefits. I think we've all noticed that of working remotely in terms of kind of travel and appointment times and so on. But I think we're now all missing that human contact, that one-on-one, and I don't think anything can really replace that. So I think the COVID vaccination program has a huge kind of role in getting us all back to some kind of normality. And my other role is as a GP partner and trainer in Fairfax Group Practice, which is in the south of Bury. So it's in a predominantly Jewish area. We've been working with the community to allay fears and worries around kind of what is it in the vaccine and making sure that it's safe for people from various kind of backgrounds. And I've been really proud of my practice in terms of everyone's input into the vaccination program. It's been a huge effort on the part of primary care. So many of my colleagues have put additional time and resources into getting this up and running. And the fact that we've kind of chipped away and the numbers now that we've got in terms of vaccination are absolutely amazing. We've seen very few if any, kind of serious adverse reactions. So hopefully we can allay some fears this evening that it is safe. I can understand people's concerns about the vaccine, looking at the kind of amount of data that's being put out there. I've been looking over the medical journals over the last few days in response, in leading up to this event. I would say 80% of the BMJ is full of COVID-related articles, and it becomes completely overwhelming about the amount of data that's out there. But we have to look at the bigger pictures about safety and numbers, and heading back to some kind of normality within society, hopefully soon.
Amazing. Thank you, Luke. I think everyone would agree that we have two fantastic experts here that cover a broad range of experience and expertise, so that we can tap into that wealth of knowledge and information. So whatever your questions or concerns might be as they come up, please just feel free to send them into the Q&A tab that we have in the interface here. So I'm now going to pass on to Paul Martin, who's going to tell us more about what the LGBT Foundation are doing in relation to COVID-19.
Brilliant. Thank you very much, Rita. And a massive thanks to you and Luke and Michael for being here this evening. Really, really appreciate it. It is a really, really important event that we're doing. And so thank you very much for your support. I also want to say thank you very much to Joe, Sophie and Stuart from my team, who have actually been working in the background putting tonight on. So thank you very much to you. LGBT Foundation, for those of you that don't know who we were established in 1975, and we exist to support the diverse needs of the widest range of LGBT people across the country. We believe in a fair and equal society where all LGBT people can achieve their full potential. We're a national charity, and we're also firmly rooted in our local communities of Greater Manchester. We provide probably the widest range of health and social care support services for LGBT people than any other organisation of our kind in the country. Each year we serve over 40,000 people, and I have to say that the lockdown has not decreased the amount of people that we are supporting, nor the amount of work that we're doing. We feel like we're busier than ever, and we also support a further 600,000 people online as well. And as a result, we probably serve more LGBT people than any other charity of our kind in the UK. Next Tuesday is the 12-month anniversary of LGBT Foundation becoming a remote service delivery organisation. In line with probably most of you, we started working from home initially for a 2-day pilot to stress test our systems, and we've never been back to the office. In actual fact, we got rid of our office during the last months as well. So we are currently in the process of looking for a new community centre in Manchester's LGBT village. This last year has not been easy for any of us, and it's true to say that COVID-19 has a disproportionate impact on the lives of LGBT people in this country, although people have not really been talking about it. LGBT people's experiences of COVID-19 have not been part of the narrative, have not been part of the evidence gathering exercise, and so a number of LGBT charities decided quite early on in the pandemic to actually develop our own research studies to sort of like see the impact on our communities. And as I'm sure you can understand, there were many LGBT people that had quite significant health inequalities prior to COVID-19. And actually all we've seen is that COVID-19 and the pandemic and the particularly the lockdown and the isolation of lockdown have actually kind of like just increased those health inequalities even further. And the work that we've undertaken, the research work that we generated, Hidden Figures, actually found that significant numbers of LGBT people were experiencing mental health problems and challenges, were kind of like experiencing difficulties with alcohol and drug usage. They were also experiencing quite hostile living environments as well. And sadly, our domestic abuse services have significantly increased the number of referrals in the last 12 months. So one of the things that we're really clear about is that COVID-19 has had a significantly negative impact on our communities. And we also know as we come out of lockdown, that actually it's going to continue to have long-reaching impact and effect on LGBT people in this country. So for many of us, the vaccine and the vaccine rollout is a potential for us to get back to some sense of normality and begin the slow road to recovery through some of the challenges that we've met. So we undertook, in partnership with Carl, who I know is on the call, Carl Austin-Behan, who is the Mayor of Greater Manchester's LGBT advisor, he and ourselves worked together to sort of like do a quick piece of research to assess the impact of sort of like the vaccination program and whether LGBT people were likely to go for a vaccine, and also what some of their concerns were. And really, really brilliantly, our survey found that overall, LGBT people that we were in contact with and who kind of like responded to the survey were very positive about the vaccine. And the suggestion is the vast majority of LGBT people are just as likely to have the vaccine as the general population. However, there were some people that put forward very specific queries, very specific concerns. And that's what's led to this evening's event. We felt it was really, really great to get two of the sort of like most prominent queer medics to answer your questions this evening. And so thank you very much, Luke and Michael, for agreeing to be here and answering those questions. So one of the things that I really, really want to encourage you all to do is to give us your questions in the chat. Because of very, very, very sensible reasons, we're not sharing that chat functionality with everybody. We want to protect all of the participants and also the speakers. We want to make sure that we can do that, and so therefore you won't be able to see the chat, but promise you that we will be assessing it and we will be kind of like putting your questions to our speakers tonight through the clever and careful handling by Rita. So I'm just going to finish now. I'm going to disappear. I'm going to be leaving the stage for the stars. But I just want to thank all of you for giving up your evening tonight, and thank you very much for your support. And so I'm going to hand back to you, Rita. Thank you very much.
Thank you so much, Paul. Thank you for that. That was really useful background information about the brilliant work that LGBT Foundation are doing, and to create this platform as well. So we'll kick off. The first question that we've been asked is probably one of the kind of standout questions that I think exists in our community. And that is from somebody who is HIV positive, and they've asked whether the vaccines will have any kind of interaction with their HIV medication. Michael, do you want to go ahead and answer this?
Yep, happy to. Probably the commonest question I get asked in the clinic as well. Simple answer is no. In no way will it interact with your HIV medications. I think one of the challenges, and this is probably a theme that we'll come back to, that drives anxieties, is the fact that things have been moving very quickly. I mean, the vaccine trials are massive. There have not been vaccine trials this big, this successful, probably for any other disease. But I think that also drives some of the anxiety. How's it come so quickly? That can't be right. That makes me feel a bit nervous. But also, because it still is at very early days in the vaccine, that there is an element where we still haven't got the data to prove what we really believe. And that's a thing that's specific for people living with HIV. And other areas as well, because in the early days of the vaccine, and this is not specific for COVID, it's for lots of things, that they generally focus on people who are well when they start to recruit. So most of the early data that was published on the amazing efficacy of the COVID vaccine didn't include people living with HIV. Now, clearly, that's improving now. So we now do have more and more data on people living with HIV that's beginning to be published, but also we have a lot more real life experience of people living with HIV. So I think it's sometimes being able to address that issue that the absence of data doesn't mean that there's necessarily a problem, and we can make very solid or draw very solid conclusions from how we know how the vaccine works, for example. So I think this is the case, well, this is the case for HIV medications, but it's the same thing for any other medications. It's a question I get asked about HRT or cross-sex hormones from trans patients. The way the vaccine works goes nowhere near the way that you metabolize your drugs. You know, when we know that something might interact with the drug that you're taking, whether it's HIV medication or whatever, it generally has to be involved in some part of how that drug is metabolized in your body. So it has to either affect how it's absorbed, or it has to affect how it's broken down in the liver, or it has to affect how it's kind of excreted or got rid of out of the body. And the way the vaccine works is completely separate from that process. So even though we're beginning to get more data, but we don't have huge amounts of data, there is no scientific reason equally for us to think that there could possibly be any interaction with HIV medication. So whilst, you know, there are still some grey areas and we still need more data, I would say with absolute 100% confidence that the vaccine will not interact with your HIV medication.
Okay, brilliant. I think that was a really thorough and detailed explanation. I think this is the kind of detail that everybody is looking for and the kind of information that we need. That is quite difficult to find when we're relying on search engines and we're just looking at Google. So following on from that question is a related one that may be covered by what you've already said, which is in relation to PrEP. Somebody's asked, should I stop taking PrEP whilst I have the vaccine? Will it affect how effective the vaccine is? And Michael, I don't know if you want to go for this one as well.
I'll try and do this in a more shorter version.
No, please don't. Be thorough.
Same answer. Absolutely, it will not affect your PrEP. So keep taking your PrEP as normal for the same reasons. You know, I mean, again, you can't point to a study that looks at scientifically the impact of PrEP and any, you know, to prove or to publish that there's no interaction, but what we know scientifically about how PrEP works and how the vaccine works, there is no way that they can come anywhere near each other and affect each other. So again, 100% confidence. You don't need to worry about any interaction between PrEP and the vaccine, and keep taking your PrEP as normal. And as I'm sure we're all going to be saying, take up your vaccine when it's offered to you. The only other little thing I would just add there, I think one of the reasons why there is some concern or misinformation around HIV drugs specifically, because certainly at the beginning of the pandemic, there was a bit of a suggestion that some HIV drugs might actually work against COVID. So I don't know if that's going to come up as a question, but I'll just address it out. They don't. So PrEP doesn't protect you against the vaccine, nor do any other HIV drugs. That came from the fact that other types of coronavirus, so things like that called SARS or MERS, in laboratory test tubes, one HIV drug has been shown to do something, but it doesn't do anything in real life. So the other myth that I want to bust, whilst really stressing that the vaccine has no impact on your HIV treatment and no impact on PrEP, the other myth to bust is your HIV treatment and your PrEP has no impact on your likelihood of catching COVID or how it may affect you with symptoms of it.
That's brilliant. Thank you, Michael. Again, I think this is, you know, hopefully peace of mind for a lot of our community out there to have access to this sort of information. And the next question I want to put to you, Luke, it's about HRT and hormone therapies in general, from somebody that is worried that they might have an effect on, the vaccine might have an effect on their hormones. Did you want to pick that one up?
Sure. As Michael alluded to, in terms of medications and the vaccines, you know, they work in very different ways, excreted, metabolized in very different ways. And it's the same with hormones. There's no evidence that having the COVID vaccination will affect or alter your hormone levels. I know that there have been some kind of small studies looking at actually whether estrogen may be a protective factor against COVID-19. I mean, still we need loads more information from kind of bigger studies moving forward. But there is some some early data that may be that estrogen may be a protective factor. So definitely something to look at, but definitely not a reason to not have your COVID vaccine. And if we look at the absolute contraindications for COVID-19 vaccination, they're really, really minimal. It's whether you've had an anaphylactic reaction to it before, or you're known to have an anaphylactic reaction to any of its excipients. So there are really very few reasons to not have the vaccine. The vaccine is safe, and in terms of HRT and hormone replacement therapy, I would recommend our patients to carry on taking their hormone regimes and have the COVID-19 vaccine. Will we ever get a study about trans women taking estrogen and the effect of the COVID-19 vaccine? Probably not. So we probably have to extrapolate from kind of what we know in terms of the cisgendered population and those taking HRT in kind of postmenopausal women and things like that. And again, we're giving the COVID vaccination, or recommending to people as they get older, and nowhere does it say to not have COVID-19 vaccination if you're on any form of HRT therapy. So I would say recommend carrying on with what you're taking and have the vaccination.
Brilliant. Thanks, Luke. I hope that's really clear for everybody. It's really clear to me, but if you have any further questions about any of these points, then throw those into the Q&A box. We've had a few questions that have come in, and I'm just going to jump on one of those now, which might be one for you as well, Luke. And it's from Paul Ryder at Lgbt Sparkle. And they've raised that there are some concerns for support for the trans community while they're waiting for their gender clinic. And you alluded to this earlier, with so much not being able to be done in person. And there is something, really important about that in-person connection, particularly for our community, I think, and that one-to-one relationship building. So the question really alludes to mental health being a real concern. And I guess it's probably less of a question and more of a comment that I guess we can get your input on and your expertise on. What can we do here? Because I know that like we all know that our based on what we've already talked about, that there are huge concerns for our community, but for the trans community in particular, do you have any advice or tips when it comes to mental health while people are living in this pandemic and also going through a transition?
As you say, we know that everyone's kind of mental health and well-being is being affected by COVID-19, from really small things about the kind of less social interaction through to really kind of severe mental illness and psychosis, etc. So a real range and variability in the effects of COVID-19 on people's mental health and well-being. And it's going to be a huge challenge now and moving forward. And I think some way even moving out of the pandemic, when people kind of reflect and reassess and think about what we've just been through, I think that's going to have a huge effect as well. In terms of support, particularly for kind of the trans and non-binary community, I think from an Indigo perspective, I mean, first, it's great to have a trans and non-binary service within Greater Manchester. If we're just talking kind of locally, first of all, and patients on our waiting list can access help and support from talking therapies as soon as they become a patient of Indigo, so they don't have to wait for their assessment appointment with a clinician, with a GP, before they can access that help and support. So for our patients on our waiting list, there's much quicker access to kind of mental health and wellbeing support, both through Indigo and through the wider kind of services that are available for the trans community, like the LGBT kind of foundation support and all the other great organisations such as the Proud Trust and things across Greater Manchester. So I think it's going to be hard because a lot of services are remote as well. So talking therapies are all being delivered remotely. And I think it's moving forward how we look at that, a blended approach of delivering kind of face-to-face and remote services kind of to patients and service users. But I think more investment is going to be needed in mental health services moving forward. I think we all know that, from low level right to kind of secondary care mental health services. So I think there's a huge amount of work that's going to need to be done to put that in place. But I think we're lucky within Greater Manchester of the services that we do have, and it's how we extend that out and make sure that they're available to as many patients as possible moving forward.
Brilliant. Thanks, Luke. Michael, is there anything you wanted to add before I move on to the next question?
No, I think Luke answered that perfectly. And I think, in many ways, with my national hat on, we look enviously at the focus on the LGBT community that Greater Manchester has. There's amazing voluntary organisations that have Indigo. So yeah, what Manchester does, the rest of the country should follow, in my mind.
Brilliant. So I'm going to move on to. I've got one question here that I think is a really important one to look at, and then I'm going to move on to a question that's come in live from Claire. But before that, the question that came in beforehand is to do with religious beliefs and the vaccines. And somebody has asked, I've heard that the vaccine contains animal products, and I'm worried that this will go against my religious beliefs. How can I be sure that it doesn't? That's to either of you.
So it doesn't. I've double checked, triple checked. As I said previously, I work in a Jewish community, so it's something that I've been very aware of from the start, given dietary restrictions and so on within that community. So it's something that I have looked into, and I can categorically say that none of the vaccines contain any animal products or eggs. And if people want to be reassured, they can look on the gov.uk website and the Green Book, which is another really good resource that's got kind of all the up-to-date information about the vaccines on. So I think myself and Michael will both say there's no animal products or eggs in the vaccine, but there are various sources that you can go to quadruple check that if you wish.
Okay, good. So it's vegan. I know that's going to appeal to a lot of people I know. So I'll move on to the question from Claire. And then I've got another really interesting question that I'll follow up with that's come in live as well from somebody anonymously. But this next question is, Claire works clinically within a NHS hospital, and over the pandemic has been the vice chair of the LGBTQ+ staff network. Now, she says, we find that our meetings are being cancelled purely down to workload. However, the network was set up on the back of the Hidden Figures report. How do you suggest we remain connected and supportive of each other?
Shall I? So I'm happy to start with on. I mean, that's a really good question for many reasons. One, it highlights the fact that NHS staff are battered by this pandemic. They are exhausted, they are burnt out, and they've worked so hard for more than a year, and now they're still doing even more. The amazing work that Luke and his colleagues are doing around vaccines, it feels like it's never ending, even though things are beginning to quieten down a little bit in the hospitals, there's still huge amounts of work that's going on above and beyond what would normally be happening. So I think it's really important to recognise that. And we need to do more about that. And I'm glad that from a national level, certainly from an NHS England level, there is starting to be more discussions when we've been talking about recovery for a long time, recovery from the virus, but actually now that discussion is now being talked about recovery for the workforce as well. There is a real recognition of how much people have given and how burnt out pretty much everybody is. So I think that's a really important thing to raise. And also the second thing I think is again, that comes out in Claire's point on Claire's question, is that the real importance of networks for LGBT for the LGBT workforce. They are frequently really great areas of safe space and support and community for LGBT staff, and I see all around the country LGBT networks being real drivers of change for making their workplace more inclusive, and also for making their service wherever they are, usually in hospitals, but wherever they are, more inclusive of their patients. And often it's the networks that are leading on that rather than the organizations. And I think, like many things, the day-to-day has had to be put aside. But my main answer is that I think organizations have a responsibility to protect the mental health and well-being of their workforce, and LGBT networks, as Clara said, are a really good way of doing that. Or clearly there are many other ways of doing that. So I think, where good organizations recognize the power of the network, then they will provide more support. In the reality, though, like everything it's kind of normal and day to day has had to down tools, and everybody's been redeployed and refocused. So it has been difficult to do that. So I think my general answer would be, I mean, certainly this is what's happened. I work at King's College Hospital in South London, where we've got a reasonably sized and developed LGBT network. Like everything else, it's become a lot more virtual. So short webinars, end of the day or lunchtime or break time opportunities to drop in virtually. WhatsApp groups have really kind of blossomed. So I think we have to be creative to find ways to protect ourselves and our colleagues and our communities whilst we come out of that. But I definitely would say that the system, by which I mean organisations and the NHS as a whole, has a real responsibility now to focus on mental health and well-being and recovery of the workforce.
Luke, did you want to add anything to that?
I think this is where the kind of positivity of remote working or remote joining up has come in, hasn't it? In terms of we've been able to grow and get bigger networks of people. More people have been able to attend meetings, however it's remotely, and we've all been able to now go to like 5-10 meetings a day rather than 1 or 2, and there's good things to that and bad things to that. But I think we also need to look at the future and coming out of the pandemic, and we've come together in different ways, and it's how we then use that to move forward to kind of better things for the LGBT community within the workspace.
Okay, brilliant, thank you. I'm just fielding this next question, which is really interesting, actually, and I think it's sort of related to a lot of questions that have come in, and it's really about sort of navigating space in terms of people having had the first dose. So many people have now been vaccinated and may feel free to move around, and this question is in specifically relating to a lot of apps and dating apps where people are meeting having had the first dose, and it's really about safety. Should people how much access should people really be having after the first dose before the second? This is the big question, isn't it? Because we have such a big gap in this country between the 2 doses. And it does feel quite hard to navigate knowing really what the level of safety is. And I guess the answer is in many ways we don't know because we don't have the data. But I don't know if you could, I guess give any guidance in terms of how people should be exercising safety after the first dose and before having the second. I know in general the guidance is to wait 3 weeks after the first dose before sort of interacting for it to really kick in. Luke, I don't know if you wanted to pick up on that.
I think we have to keep going. I think, we've all had so many restrictions put on our lives for such a long time that you would think, oh, I've had the first dose, right, I'm going to get out, I'm going to wait 3 weeks and then get out there in the world. And it could mean that we end up going back into some lockdown. So as hard as it is, I think we need to persevere and keep going and wait till we've had our second doses. And we know most immunity comes from our first dose of our vaccine, but we're still working on this 2-dose schedule up to 12 weeks apart. And we have to keep following the social distancing and the mask wearing until we get more data to know that it's safer to mix for the first dose. We don't know that yet. We still don't know about the kind of reduction in transmission in terms of having the dose. And we know that many, especially young people, are asymptomatic, so you don't know if you've got coronavirus, and the vaccines are not 100%. So we have to take all these factors into consideration and think, we don't want to be going backwards. We want to be moving forwards out of this. And the biggest way to reduce social distancing moving forward is the vaccination program. And I think we should stick with what we're doing until, as hard as it is, and I think we all know how hard it is now, we're all finding that this last kind of push, the hardest that it's been. I know I am, in terms of the third lockdown, and I'm very lucky. I've had my second vaccine now, but I'm still having to kind of restrict what I do, still keep going with the PPE and the social distancing in work and keeping all the rules in place until we can be sure that this is going to get us out of this, and we're not going to go back into another national lockdown because we've all got overexcited after our first vaccination.
Okay, so just keep going. It's the 11th hour, everybody.
Yeah.
We need to remember we've all had enough. It's the end of winter, a series of lockdowns. I think, everyone's pretty frustrated. Michael, is there anything you wanted to add to that?
No, I think Luke said it really well. I mean, the only couple of things I'd add really is that, the vaccine is amazing and it is our way out, as Paul Martin said at the beginning. But at this stage where we're at, it is so fragile, and the vaccine alone will not get us out of this where we are at the moment. So it still has to be social distancing, lockdown rules. There is definitely an increasingly large or growing light at the end of the tunnel. But, as we said, it's not, I mean, it's amazing how well it works. It's not 100%. We still don't really know what the impact on transmission is, what the interaction is with asymptomatic people who may or may not have had vaccine. We talk about how effective it is, 94%, whatever. But, there'll be a range in that. We don't know quite how long that lasts for. So it will definitely bring us out of the misery of the third lockdown, but it's so fragile at the moment, so we really shouldn't get too overexcited. But it is becoming increasing. If we stick with it, and I mean, and move forward with the vaccine, it is increasingly getting closer to normality.
I think, thank you both, and I think that I hope that answers the question, because I think there are lots of unknowns, but I think in the UK we are very much ahead of the curve in terms of global uptake of vaccinations and the number of vaccinations being rolled out. And I actually read a fantastic piece on Al Jazeera about the UK really being praised for the way that the NHS is structured in a decentralised way, which allows for very fast rollout of the vaccinations in this country. So we're really ahead of the curve. And so in that sense, that's a real positive to hold on to. Not just the spring and the sunshine. So that's something to do. I hope answers the question. I think just to say as well, just to remind everybody that you can ask questions anonymously in the Q&A tab. There is the option to select anonymous, so your details are not shared. Just to clarify that, if you want to ask something anonymously. So I will move on to another sort of area of questions, which is more to do with side effects. So there have been lots and lots of questions and across the board with people sort of sharing the kind of side effects that they've had, which seem to vary quite a lot. And a number of people have asked, what are the side effects and what are the likely side effects? And I think it's important to know, just in terms of planning time around after you've had the vaccination, do you need somebody there to care for you, etc., especially if you're living alone? So I will put that to you, Luke.
Yeah, most side effects are mild. You know, typically what you'd have from when you have the flu vaccination for those people that do have it. So a sore arm, feeling a little bit fatigued, sometimes having a low grade fever or temperature. But very, very mild and short-lived. So the sore arm can be kind of 24, 48 hours, and then you bounce back to normal. From my personal experience, because the two vaccines, I was a little bit worse after the second vaccine. So I probably mounted my immune response with my first one, and then when I had my second vaccine, my immune system probably went a little bit wild and crazy, and kind of made me feel, you know, a little unwell through the night. And that's a common story I've heard, but then I've heard other people be absolutely fine and have no side effects at all. I was annoyed with my husband when he had his first vaccine and had no side effects whatsoever. So it's kind of, you get a little bit jealous about kind of vaccine side effects and so on, because it is so variable and different people mount immune responses differently, and that's always going to be the way it is with any vaccination that we have. But I think we can say that overwhelmingly people have very mild side effects, very short-lived. Everyone recovers well from them, and it's your normal bodies. It's not you having a reaction to the injection. It's actually your body's immune response. So in a way, it's a good thing if you have a good, strong immune response that you've mounted an immune response to the vaccination.
So does that mean if you have a reaction to it as you feel unwell the next day or for a couple of days, that your immune system has responded better to it? Is that generally?
I don't necessarily think it's, I just think it's everyone responds differently and has differing symptoms of an immune response. So I don't think you can say that your immune response would be any better or worse, you know, if you felt unwell or you felt completely fine with the vaccination, because as we say, everyone's immune response is slightly different.
Okay, great, because that question has also come up. So there's a question from somebody who has a friend who has had COVID-19 and is skeptical of the vaccine, and they consider themselves protected because they have antibodies. Do you feel that, is there any evidence to prove that? Is there any evidence that you are potentially immune or safer if you've had COVID or for any period of time as well, Michael?
So we would definitely recommend you have the vaccine even if you've had COVID, whether you suspect it or whether it's been confirmed, because, and this is one of those things that we're still learning about, but it looks like certainly whether you've got some immunity, definitely if you've had COVID, you get some immunity, but it doesn't last for very long. How long it lasts for is still a little bit unclear, and also how long the immunity from the vaccine, how long does that last for, is still a little unclear, because, you know, people haven't been followed up long enough to know it. It seems that in COVID, and this looks similar to other viruses in the same family, that your natural immunity, so the immunity you get from having the infection, perhaps lasts for 6 to 8 months. So it's not forever. So you definitely should have the vaccine even if you've had COVID before. And from the immunity you get from the vaccine, we're still working out how long that lasts for. I mean, personally, I think it's likely that we're all going to need boosters at some point. You know, this probably is heading towards something a bit like flu jabs that happen every year, because it's certainly what we know about other coronaviruses in the same family is that, you know, the vaccine is really effective, but it doesn't last forever. And I think there's also the thing is that you know, I mean, there's a theoretical thing to think that actually, you know, a vaccine on top of a previous infection may actually be boosting. It's like, you know, you've got some immunity from the COVID you had before, then you have a vaccine first dose, then you have a vaccine second dose. So probably, I think it's not unreasonable to think that for many people that will be boosting, and perhaps gives you higher levels that might last for longer. We don't know, but definitely have the vaccine even if you've had COVID before.
Yeah, okay, that's really interesting response that I haven't heard before, actually. Fantastic. Okay, so we have a couple of great questions that have come in. Just wrapping up this last one, there was a concern that this person's friend had about the long-term implications or effects as well of the vaccine. Do we know anything about what that might look like at all?
Probably seeing as we only started late last year, given the vaccines, it's very early to know, isn't it, about any kind of potential long-term implications. But I think based on other vaccine programs and what we know about immunity and the immune system and how these things work, that the chance of any long-term risks are very, 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 very low. And we have to balance that against the risks of things like long COVID, which we know people are kind of really suffering months and months and months down the line with kind of fatigue and mind fog and muscle aches and shortness of breath. It's still really ongoing, and we know that there's lots of kind of resources being pumped into long COVID clinics because we know this is a big issue. And I think if we balance that against the risks of the COVID vaccination, then I know which I would prefer: the short-term sore arm for a couple of days and possibly feeling a little bit off, versus kind of 6-12 months or even longer potentially of kind of fatigue and various other symptoms of long COVID.
I mean, I think that's right. And I think the other thing that I'd add is, again, whilst it's early days and we don't know all the information, it's not unreasonable to extrapolate how we know how the viruses work. So for the vaccines work, sorry. So the two vaccines that we're using in this country, the Pfizer vaccine and the AstraZeneca vaccine, they work in slightly different ways, but the way of stimulating your immune system with Pfizer is kind of giving a little bit of genetic information that stimulates your immune system. With the AstraZeneca, it's a kind of a type of cold virus that won't cause anything. But both of those things don't stay in your body. So they stimulate your immune system and then they're kind of destroyed by your body. So there's nothing left, if you like. Once the initial stimulation of you, and this is probably why the immune response doesn't last that long, because the thing that you're being vaccinated with that works to stimulate your immune system doesn't stay in your body. So I think also knowing that, we have to wait probably another 5 or 10 years to prove it. But scientifically, it feels very unlikely that there's going to be any long-term side effects, because the initial thing that you were given to stimulate a natural immune response has long gone and is moved out of the body very soon after the vaccination.
Okay, brilliant. Thank you both. So we have a question that's just come in from somebody anonymously who says that 2 of our local vaccination hubs have closed today due to lack of vaccines. Is this a national problem? Michael?
Oh, well, I'm going to hand over to Luke. Much closer to the vaccine supply chain than I am.
I mean, I don't think it's a problem in terms of, if you look at the numbers of people that we vaccinated already, and as we spoke about previously, compared to the rest of Europe and the rest of the world, we're doing an absolutely amazing job with our vaccination program. There is the slight issue, well, not the issue, but people needing their second jabs is now coming through. So that is going to have an effect on demand, because the patients will need this within the 12 weeks. People are starting to come up to the kind of crunch time of having their second vaccine. So there is going to be that need to keep some additional vaccine to supply to those patients that need their 12 weeks. So I think the supply may be kind of shifted slightly so that we can ensure that people get their second vaccine, which is important within that 12-week time frame. But from my area particularly, I know in Bury we've had a really good supply of vaccine, and it seems that there is enough there to have got through, our first kind of high risk groups that we've all been desperately hard to get in and work on, and we've all done so well that we're now moving down those into the age categories. So I think that, you know, a lot of people have taken up the offer of the vaccination, which is great. I think the supply is there, but I think we just got to make sure that there's enough to make sure that people are able to get their second doses when they're due.
Brilliant. Michael, did you want to add anything to that?
No, I think that's right. It just feel a little bit transitional where we're at the moment, and as we said, I think we have to go back to the fact that whatever you think about how we as a country have addressed this pandemic, the vaccination response is remarkable. It is off the scale incredible. In such a short space of time, I think we're about 23 million people vaccinated in this country. It's amazing, and it's a lot of that is down. I genuinely believe it's down. You know, it's down to people like Luke and their colleagues in primary care and the NHS. You know, they know how to do this kind of stuff. So it is, where we're at is absolutely incredible. In fact, we're ahead of where we were expecting to be, and you know, there are all these these 9 levels of priority. I think soon we're expecting end of March, early April to be getting into the right. Everybody just come and get a vaccine. You know, and things are still cranking up. Certainly, where I work in South London, there's new vaccine hubs. There's a big one being opened up in our hospital. There's one. You know, they're happening all over the place. You know, so that has been really amazing. There is a bit of a transition probably in this, because now we're at the time that people need second vaccine, and the first people had Pfizer, so they've got to have Pfizer again. But we're actually also, I think, this transition when, you know, most people are now getting the AstraZeneca, where we've got, I think, we bought like 100 million doses or something. So, you know, we've got huge amounts of that. So there might be a little bit of a transitional thing, but whilst there may be a few places where there's some issues, I think generally the picture is cranking up and it's accelerating. We're doing a really good job.
Okay, brilliant. That's all good and positive. So we have a number of questions actually that are sort of geared in a similar sort of area. I'll start with one of them, which is, as a neurodivergent person, I struggle to access simple things. Will there be access support to discuss these matters in greater depth with NHS staff prior to making a decision? And if I choose not to have the treatment, will my decision be supported, or will I be socially penalised for that? That's probably a separate question, which a number of people have asked, which we can come on to. But if we look at the first part of the question, which is really support needs of people who are neurodivergent in terms of, you know, asking questions and having that kind of access. Luke?
Yeah. I think if you've got questions, it's important to bring those to primary care. You know, we are in a great position to answer questions about the vaccine. We've been doing it. We've been, you know, at the forefront of setting up the clinics and resourcing the clinics. Most clinicians have done shifts in the vaccination centres, so they know how these things are run. So I think if you've got particular questions about the vaccines or concerns, then each GP surgery often has a lead that's been working within the kind of the vaccination program, because groups of practices now work together called PCNs, or primary care networks, and they've been heavily involved in the vaccination program. So within my practice, there are 2 GPs that have been leading on this work, and we direct any kind of questions that are a little bit outside the norm, or any questions that other clinicians might not be too sure on, to those. And I'm sure most practices have that. So approach primary care. Primary care is open. We've been open through the whole pandemic, and in terms of giving advice, practice nurse, it doesn't have to be a GP, it can be a practice nurse, but just approach reception and say that you've got questions or queries about the vaccine, and most of those can be answered online. But obviously there's a huge amount of information out there. Sometimes it can be a little bit overwhelming about where to look, but at least your primary care provider can redirect you to the most appropriate resources that are there.
Brilliant, thank you, Luke. I think we have about 15 minutes or so for questions, and before we start looking at the kind of social implications of those that may choose not to be vaccinated or may be unable to be vaccinated, I wanted to explore people of colour communities, or BAME, or Black, Asian, minority, ethnic, and you know, the facts around the levels of uptake being generally lower, and the level of infection being generally higher, and obviously that's a real concern. What do you feel are the solutions to that? You know, there's obviously a lot of misinformation that's been spread, but I think fundamentally, what do you think are the reasons for that? And what do you think the solutions are for that? Luke, I'll start with you.
I think it can come from a point of distrust about, you know, not feeling that you are often part of the system as well, and not understanding why something is relevant to you. And I think it also relates to the LGBT plus community as well, doesn't it? That, you know, the information isn't always there or isn't directed particularly towards you, and sometimes that can make people feel as if they're not involved or not part of that decision or conversation about them. So I think it's trying to get information out there in a way that people feel is trusted, just by like us doing this event for the LGBT plus community this evening. I know that lots of events have been held for different ethnic and religious groups to try and engage and get the uptake there, and we've seen that work really positively. We've got a GP who works in Oldham who's been out into the community, and you can see the uptake has risen just by kind of that visibility from healthcare professionals that you can associate with.
Michael?
Yeah, no, I would agree with that. I mean, I think a lot of it comes from that confidence and trust, and what I've really learned is that actually it's really important just to sit back and listen to what people's concerns are, because actually they are often make sense. You know, it's founded in stuff that makes sense. You know, and I think the worst thing that either we as individuals can do or the organisation, the NHS, can do is just do this patronising, eye-rolling, oh, it's just fake news on Facebook. You know, it's not that. You know, and actually when you talk to people, it makes complete sense why they're really nervous about it. So if you think about Black, Asian and minority ethnic groups, you know, they naturally have a distrust of the NHS. You know, the NHS, well, not the NHS, health globally has a history of treating Black, Asian and minority ethnic people really poorly. You know, it's not too long memory that clinical trials were done in Black people in America, in syphilis, for example, where they just left them to have syphilis just to see what happened. You know, people know about that. Another real challenge is just the name Pfizer is very triggering, because there was a big scandal. I mean, most pharmaceuticals have got companies have got something dark and unpleasant in their past. You know, Pfizer particularly had a big scandal around I think it was a meningitis trial in Nigeria. You know, so it comes from a real place. You know, the concerns about fertility come from a real place. There were no pregnant women in the trial, so maybe that's because there's a problem about fertility. So our job is to sit back and listen to and hear what the concerns from, and to acknowledge them and not to dismiss them, because my experience has been is that it actually makes sense where they've come from, and it's not too difficult to discuss and challenge and move people from a place of distrust to a place of trust. But also that, you know, completely agreeing with Luke about that, you know, that has to be about who gives the message. I think there are loads of really great examples, locally probably more so, but also nationally, where, you know, people are recognizing that, you know, you can't just have, you know, a white middle-aged professor of whatever standing up and saying, you know, the vaccine's really great, you should all have one, you're a little bit foolish for, you know, looking at that meme on Facebook. The message has got to come from trusted people. So it's got to come from the community. It's got to come from people who are LGBT or who are from BAME communities or faith communities. It's got to be driven by people who have trust. And those of us who work for the big institution have to recognize that a lot of people don't trust us, however nice we might think we are. And we need to, you know, engage with communicators who are trusted. I think there's loads of examples of that working well, and on a national level, on promotional level, on a local level. And, you know, I found if you spend the time on a one-to-one level having those conversations, there, you know, I think most people's concerns are easy to address, but you've got to acknowledge them and not dismiss them.
Okay, brilliant. Thank you. That was really helpful. And I think that's, you know, they're really valid points. That mistrust exists for a reason. And it's really good to acknowledge that. And I think a lot of this really comes down to some of that one-to-one interaction and communication that you're talking about. And also allude to some of the other questions that we've just had in while you're speaking. They seem to really be around sort of access. So one of them is somebody asking how you get a COVID-19 vaccination if you don't have an NHS number. Very practical question.
I'm interested in what Luke says about this. Actually, I've been doing a bit of work in HIV around this because there's a reasonable proportion of people living with HIV who don't disclose their HIV status to their GP because of stigma, so therefore they're not going to get called early. And we have a reasonable number, particularly of migrant populations, asylum seekers who aren't registered with GPs at all. So I'd be interested in how, if Luke's come across that practically on the ground. I've been trying to find some national guidance for it, and I can't find any other than people seem to be sneaking people in, or just, you know, I'm not quite sure. Tell us what you do, Luke.
Yeah. It's not something I've actually come across personally. I don't think I could add anything else to that. It's a very good point about how we get those people that are potentially kind of could slip through the net. And I think the other population is the homeless population, and we just went out and offered to kind of homeless people that were locally to the surgery, but these are probably patients that aren't registered with a GP surgery, but I don't think they say there are any kind of formal guidance on how you do that, other than kind of, we shouldn't rely on goodwill or just going out in the community. There should be a recognised pathway to get the patients that aren't registered with the NHS but should still have the vaccine to still be able to access the treatment.
Yeah, I mean, I think that's right. I mean, and the homeless is another good example. So when I was trying to find the answer, I went to the person who's in charge of the COVID response for homeless people at NHS England, and they were saying, well, look, there isn't any national guidance, and actually what's happening is, you know, sensible local providers like Luke are going out to, you know, their homeless hostels or shelters, or working with their local charities to do that. I think that the other thing is that having an NHS number isn't what makes you eligible for a vaccine. It's just what helps you to access the system. It's just what, you know, if you're registered with a GP and therefore have an NHS number, you're going to get called, you know, at the right time, and you're going to get offered. But, you know, if you're eligible for NHS care, you're eligible for a vaccine. It's just that it makes it harder for you to access it. I'm sure if you went to a practice like Luke's and, you know, and were in the category that they were vaccinating and didn't have a registration or an NHS number, you'd probably get a vaccine. And what it seemed, from what I could find out from people working with homeless people, is that vaccination hubs were, because you don't have an NHS number, it just means you can't be logged on the national system to be counted in the 23 million. But there's no reason why they can't just give you a vaccine and put it on a spreadsheet or write it on a piece of paper that it's being done and bring you back. So it needs to be worked on, and people are working on it. But it's another example of, if you're marginalised and struggle to work your way through the system, you might just need to fight your way through a little bit at the moment, but I'm sure it'll get better.
Yeah, so that's brilliant. And I think there's actually a related question from somebody that's a asylum seeker who is not able to access the funds to travel to be vaccinated or to routine medical appointments. So they have some real concerns around how they're going to prioritise the vaccination. Is there any sort of advice that we can give? I know that the intention is always to send people to somewhere as close to where they live as possible to be vaccinated. Is that something can they contact their GP and ask about that perhaps, or do they have access to a GP as an asylum seeker is the question, I guess. How do they access that?
Yeah, again, this is where the kind of structure within the NHS is come into its own, isn't it? Because we're able to provide vaccinations in so many different locations, from pharmacists to GP surgeries to the Etihad Stadium, you know, and we're giving patients choice, as they should be, about where they are vaccinated. So patients, you know, if they do get an invite for the Etihad, but that's going to be a bus ride or a taxi ride, and they don't have the funds to do that, they should contact their primary care provider, or their GP service, who will be able to look at other options to book them in at a more local venue. And we're seeing that, like I say, pharmacists, GP surgery. So there's a huge amount of options for patients to get vaccinated. And I think that comes back to the great system of kind of the national NHS, for all its failings and all the things that we do get wrong in the NHS. I think this is one that we can definitely all say is going extremely well, and a big one to get right. And we're doing it well.
Just to briefly add to that, and I think part of the problem is that people don't necessarily know, you know, that if you're an asylum seeker, if you're a refugee, if you're homeless, whether you're in the UK lawfully or not, you can register with a GP. Understandably, people frequently don't because of concerns about, you know, is my information going to be shared with the Home Office? But you can register with a GP in any of those settings. And I think, obviously, whilst it's great that there's loads of variety of locations to get a vaccine, probably your GP is going to be the closest, you know, walking distance. You know, I guess the thing is to really encourage people in that situation to register with their GP, because you can register, you know, if you're an asylum seeker or refugee.
Okay, brilliant. There's just one more question I quickly want to tackle with you, which is, I think you'll be able to answer fairly quickly, which takes us in a bit of a circle back to reactions with medications. This is somebody who is taking medication for depression, and they're asking if they will have a bad reaction to the vaccination.
I think same as previously. There's no evidence that they would have a worse reaction than anyone else, and everyone reacts slightly different to the vaccine. But no, have the vaccine. It won't affect your medication, and there's no reason to suggest you'd have a worse reaction than someone not taking that medication.
Okay, brilliant. So there's one more question that's just come in from somebody that said that it was recently reported that the morning after pill doesn't work for women with a high BMI. Do we have any information about the vaccine efficacy on people with higher BMI?
Go on, do you want that, Luke? I don't mind starting off. Do you want?
I haven't seen any data, to be honest, around BMI, and the kind of reading that I've done. It's something that I'm not sure. I'll have to pass it back to Michael and see if.
Nice try, Michael.
A friend. On that one. I mean, I think it's a similar thing for the other questions. Is that we're too early in the data to be able to start to kind of like split it out by all those different things, but I'm sure that we will start to see things come out as time goes on. I mean, for me, I just think, again, it comes back to that same thing about, you know, will it interact with my medication, in the sense that I can't imagine how it would do. I mean, I can imagine how emergency contraception would be impacted on by your BMI, because that is going to impact on how the tablet is absorbed, how much of it is spread around your body, how well your liver's working to break it down. So I can imagine that. But when we're talking about a vaccine that stimulates your immune system, which is there kind of irrespective of what your body mass is, I find it hard to imagine how it would do. And I can't also think of any other vaccines, I'm just trying to think, where there is a BMI difference. So I think probably not. That's definitely not a reason not to do it. And I'm sure it's one of those things that we'll learn more about as time goes on.
Okay, brilliant. So I think I think there's lots more that we could continue to talk about and have lots of questions around, but I feel like we've really covered a large number of the groups of questions that came in from people. And I just wanted to give you all an opportunity, to give you both an opportunity just to just to have any closing remarks, really, in terms of what you've heard so far, anything that you want to, that stands out for you that you just want to remind people of, starting with you, Luke.
Yeah, I think it's been a great opportunity to come and answer some questions, and we can see that there are definitely some themes there, you know, around interactions with medications, particularly in access to vaccines. And I hope we've reassured kind of the attendees around that and the reasons why it's really important to get the vaccine. And I think we have to remind ourselves of the wider as well. This isn't just about having the vaccine to stop ourselves or someone we know dying. COVID has had a massive impact on health, well-being, and we've seen questions around that again today. But we're seeing it having a huge impact on the health service as well, and the services that we offer, primary, secondary, tertiary care. And unless we find some kind of exit plan to COVID, then these services are going to continually be hampered. Patients are going to be kind of waiting lists longer. And we need to start making some positive kind of reductions in those times so that we can improve patients' wider health. So it's not just about the effects of COVID, it's the wider effects that is really important to me, and what I'm seeing in my patients in primary care, particularly, coming back to me again, because they're so worried that they've been on a waiting list for this long. It keeps getting cancelled because of COVID. And if we think back to last year when we came out in the summer and the numbers were down, well, we didn't have a vaccine then, and then the numbers went back up. So this is our real chance to get numbers down. Is it the vaccine? Is it social distancing? Probably a mixture of the two that are getting the numbers down. But now we've got an opportunity to keep them down with the vaccines. The more people that take that vaccine offer up, the higher chance it is that we can reduce other measures of social distancing and the restrictions that have been placed on all our lives, which I'm sure is what we all want moving forward.
Brilliant, thank you, Luke. And Michael?
Luke's nailed it really in terms of the summary.
You did nail it, yeah.
Hopefully, I mean, this has been really great. I've really enjoyed it. Thank you. And I think it's been good to discuss the topics. And I think hopefully Luke and I have made it clear about how much we passionately believe in the vaccine and want everybody to have it and to use that to see our way out of the nightmare that we're living in and have lived in. I suppose the only other thing that I'd add, and I think hopefully that's come out during this session, is that your concerns, your anxieties and your questions are all valid. So ask them, take them to someone, a healthcare professional, probably your GP, or, if you're living with HIV, take it to your HIV physician or someone else, because hopefully, they will hear you and will listen to you. So, if it's you or if it's your friends or your family or anyone else, encourage people to ask the questions. Don't feel embarrassed, don't feel foolish. Don't let it be a reason for you to miss out on the opportunity of having a vaccine, because I'm sure that we will be able to reassure you.
Thank you, Michael, and thank you, Luke. Thank you both. I've really thoroughly enjoyed this session. I've learnt tons. And I feel like I just want to give a massive thanks to Paul and Joe at the LGBT Foundation for putting this on, because it's very much needed, and possibly, we'll have more of these as time goes on. But I mean, maybe not, because you're all going to get vaccinated now.
Everyone will have it on the back.
We'll be vaccinated. Everything will be fine. We'll be raving in GAY before we know it. Thank you to everybody that signed up. You're all brilliant, and thank you so much for the questions that you've sent in. I'm sorry we couldn't get through all of them, but I hope that there was enough in there that was covered for you all to have gained something. And yeah, thank you, and have a brilliant evening, and keep in touch with the LGBT Foundation on social media, and of course just fire in any questions that you have there as well, and the team will pick it up. Thanks everyone. Have a good night.
Thanks, Rita. Bye.
Yeah, thanks, Rita. Bye bye.